Varicoceles are enlarged veins of the scrotum. About 10 to 15% of men have varicoceles. Most of the time they present no problem to this patient. They usually occur during puberty and get bigger as the patient ages. There are different theories of why varicoceles develop. Some believe that the valves in these veins are somewhat dysfunctional, and therefore the blood sort of backs up and causes swelling in those veins. Another theory is, and more plausible, is that the anatomy of the veins, especially on the left, goes into the main veins of our body at a different angle. Therefore there's a higher pressure in that vein and that blood gets engorged and backs up. And it's more severe in some men than other men. And frankly, it's just how they're made. Most varicoceles are asymptomatic. However, in some patients they become symptomatic. The most common is pain. The pain is usually a dull ache that gets worse as the patient stands. Other patients may notice that one of their testicles is smaller than the other. And finally, some patients may notice they have problems with fertility. Most varicoceles are diagnosed by the patient. They come in presenting with enlargement of veins in their scrotum. Varicoceles are typically easily diagnosed by physical exam alone. However, sometimes we'll order a scrotal ultrasound to better define the varicocele, and more importantly to look at the testicles to make sure there's no asymmetry or suggestion that that testicle may have some issues. Not all varicoceles need to be treated. Actually, most do not need to be treated. Only about 2 to 4 out of 10 people with a varicocele need treatment. The reasons we treat are for pain, change in testicular size, or fertility. The treatment of varicoceles has really evolved over time. The standard of varicocele treatment is an open operation where we make an incision a few inches long and really ligate each of those veins individually right near the scrotum. The more common operation is now laparoscopic, where we make 3 small incisions in the patient's belly, all about as big as a pencil eraser, and we ligate the vein inside the patient's body. And finally, a newer technique is one where we embolize the artery through the vein, and this is done by a radiologist. Each treatment has its own success rate. Surgical intervention is probably the most successful. The problems with each of the therapies is that they're not all 100%. Most commonly, they do take care of the pain and they do take care of the swelling, but the patient will still experience some fullness down in their scrotum. Fertility is not always resolved with the repair of a varicocele. A lot of men who have a varicocele repaired may not have their fertility issue resolved. We know most of the time their infertility issues will not worsen, but they may not get better with time. People ask, how does a varicocele really affect my fertility? It's really just a vein that's engorged. How does it affect my testicles? Well, what happens is that blood that's deoxygenated, that's leaving the testicle, that the testicle has already used, gets backed up into the testicle. Therefore, that testicle is seeing a low oxygen state. Therefore, it's essentially being strangulated, and that's where the pain comes from. And a lot of time, over time, that testicle will get traumatized and traumatized. Therefore, the cells that make sperm are no longer working as well. So a lot of times after we fix a varicocele, they're no longer getting low oxygen. However, the damage has already been done. And so that's why we not always see an improvement in one's fertility after repair. The outcomes long-term for any of the therapies are very good. When we worry about fertility, we usually repeat a fertility test in about 2 to 3 months after the procedure to see if we have any changes in one's fertility. If that's not there, we repeat it another 3 months later. And finally, at a year, if there's no change, it's probably not going to get any better.